Thank you for watching On Call for All Kids. Today we are talking about hand, foot, and mouth disease. We'll be getting into what age group is most at risk, the symptoms of hand, foot, mouth, and how it's spread, and of course, ways to prevent it. I am joined by Dr. Ebony Hunter. She's an emergency medicine physician at JohnsHopkinsAllChildren'sHospital. So great to see you, Dr. Hunter.
It's good to see you too, Ashley. Thanks for having me.
So hand, foot, and mouth disease, this is common, but can be kind of scary for parents. What exactly is it and who gets it?
So hand, foot, and mouth disease is actually a viral illness. A lot of children get it, usually younger children under the age of 8, more prevalent in preschool kids. And it affects the hand, the feet, and the mouth.
What are the symptoms? What are we looking for when this actually happens to a kiddo?
So usually the symptoms are sores in and around the mouth, as well as on the hands and the palms and the feet and the soles. Some kids can also get those same sores around the buttocks and the genital area. The sores are pretty painful sometimes, or can be, shall I say, painful. And so some kids won't want to put pressure on that area wherever the sores are located. Since it is associated with the viral illness, they may have some viral symptoms such as runny nose, cough, or fever with hand, foot, mouth.
And how do they actually get this?
It is spread usually by saliva or fecal material. So usually they've touched something that was infected or shared something of an infected person's saliva, and it was transmitted that way.
So as a parent, if we see some of these symptoms going on, we bring our kid in to be seen, is there a test to get diagnosed?
Most times there is no test needed to be diagnosed. It's a visual diagnosis, meaning we can look at the kid and diagnose the patient based on that. So there's no test usually indicated to diagnose this.
When should you actually call the doctor? And then how is it treated?
So because it is a viral illness, it's treated with supportive care. So if they have a fever or pain, you can use over-the-counter fever medicine, fever reducer, or pain medicine, which are ibuprofen or acetaminophen. We do not recommend aspirin, as we do not recommend aspirin in children less than 18 years of age. Times to call the healthcare provider or your doctor are times when your child's not eating, hasn't urinated in greater than 6 to 8 hours, or showing signs of decreased activity or lethargy, which to us means that they're not being stimulated by voice, touch, or any visual cues.
Now, should we be worried as parents and adults that we could contract it too?
It is rare. You can get it, but usually it is very mild if you do. Or you may not even have the sores. You may just have a little stuffy nose or scratchy throat. So while it could happen, it's usually not as significant.
And what ways can we just prevent this altogether?
I'm glad you asked that. So really good hand washing and really good cleaning of commons areas where children play and hang out. And so recognizing that having a dirty play area where they've taken the toys that kids have played with and cleaned them, and then clean the area is a really good way to prevent the spread.
All right, Dr. Hunter, thank you so much for joining us and telling us all about hand, foot, and mouth disease and how we can also prevent it.
Thanks for having me.
And thank you all for watching. We really appreciate it. If you have any topic ideas you would like us to look into, you can comment below right here on this video. And you can also visit our website as another resource. It's HopkinsAllChildren's.org/newsroom. Thanks again for watching. We'll see you next week.